I'm Susan Dubois. I'm an endocrinologist and I work for community care health centers, and I support this work. Mary and I have been working together for about 10 years now, working with the Texas Stride family. So I'm glad to be here today.
So in diabetes care, we hear the word neuropathy a lot. What does that mean?
So neuropathy is nerve damage. So pathy means illness. And so it expresses its way in several ways in people with diabetes. So we have an internal nervous system, the autonomic nervous system, and we have a peripheral nervous system that most people think about, the nerves that go to our toes, for example, and numbness and tingling. So neuropathy can affect all of these systems in the body and cause quite a few consequences.
Right. How can we know if we have neuropathy? What are some signs and symptoms of it?
Well, to go back to your first question, neuropathy is caused by microvascular disease. So each of our nerves, and they come from our brain all the way down to your toes, our longest nerves in our body are the ones that go to our toes. And so those are the most at risk. These nerves are surrounded by blood vessels that support them. And if the blood vessels get damaged, as vessels can anywhere, and these are tiny vessels, so we call it microvascular disease, if they're damaged, then that leads to nerve illness or neuropathy. Most people will think of neuropathy as numbness and tingling. It can also be painful. And so patients will experience burning of their feet at night that keeps them awake. And typically, neuropathy affects us most when we're trying to rest because our minds are not elsewhere occupied and we can pay attention to that pain. Usually it occurs symmetrically, so both feet will experience it, but sometimes you can get one nerve that's particularly aggravated. And so you could have a nerve, say, in your thigh or in your abdomen that really hurts. And the consequences of that then could be a diabetic foot ulcer, because normally if we put on a shoe that doesn't fit properly, or if there's a stone in it, we'll feel that as pain, which is a good thing. We remove the stone, we no longer have the ulcer. We change the shoe, we don't have a blister. But in people with neuropathy, they can't feel that. And so the first instance might be, oh, there's a hole in my foot. What do I do with that? Those are the neuropathy that most people think of. But I really think we need to talk about internal neuropathy too, or autonomic neuropathy. Yes. So there's multiple ways that can affect us. One of the most significant is orthostatic hypotension. That means my blood pressure is normal when I'm sitting, but if I stand up, I get dizzy and I might fall down even. And that may happen immediately upon standing, or it may be I'm standing up for some time and I just pass out. So that's very significant. We know that blood pressure control is critical for people with diabetes. So when you come to the doctor's office and you're sitting in the chair and your blood pressure's high because you're a little bit nervous, the doctor wants to increase your medicine. But if you have orthostatic hypotension, that can cause consequences and falls. So you need to always be sure and tell the doctor if you're having that. The other thing is you need to have your blood pressure checked, sometimes laying, sitting, and standing, so we can determine if that is actually occurring and give you the right treatment. Another very serious kind of neuropathy is hypoglycemia unawareness. So this is where the blood sugar drops, and most people with hypoglycemia will have symptoms, and those symptoms are caused by adrenaline. So they get shaky, sweaty, and that's good because it's your warning, and you can then go and get some juice or eat some food. But in patients who don't have that, they skip over that completely, and they don't have symptoms until their brain is affected. And we call that neuroglycopenia, but symptoms would be confusion, not knowing where they are or what to do, and in severe cases, even a seizure. So autonomic neuropathy can be life-threatening for those reasons. And then there are other things that can happen. Your bladder may not empty. You may have erectile dysfunction. You may have chronic diarrhea or constipation, none of which is fun or helpful. And so all of your symptoms you should be talking to the doctor about so they can understand what the next step should be.
Right. So is neuropathy, would you say it's long-lasting or temporary in that sense then?
Mm. Some neuropathy can be reversible, and the autonomic is probably, although it can be more severe and life-threatening, it might have a better, more stable prognosis if you control for factors that are causing the problem.
Right.
If someone cannot feel their feet, it's unlikely that that is going to completely reverse. Okay, so once we have peripheral neuropathy that's very advanced, it's probably not going to reverse. But if I have chronic diarrhea or I have hypoglycemia unawareness, those conditions can be reversed. And the way we reverse hypoglycemia unawareness is by getting rid of hypoglycemia very strictly. So for 3 weeks, no blood sugars under 100, between 100 and 200 for 3 weeks. And sometimes the body will reset.
And so what are some day-to-day things people can do to take care of their neuropathy?
Be aware of what your current issues are. And then for prevention, we think about the feet a lot. If you have peripheral neuropathy, or whether you do or you don't, get in the habit of examining your feet every day. Take your shoes off. Look at your skin. Are there cracks between your toes or on your heels? If you, because if you have neuropathy, we want to keep our skin healthy. So if we do get a blister or something, we're less likely to have it, progress.
Right.
So I would say just being vigilant and let your healthcare provider know immediately if you get an ulcer or blister on your foot. If you can't get in to see him, you might need to go to urgent care, but you need some way to let somebody know and get the proper care up front.
And so if a patient doesn't, what are some consequences that might occur?
Yeah, this is really sad when this happens. And I'll tell a story of one patient I had who was at South by Southwest, and he was wearing some tennis shoes that didn't fit. And I had done a careful comprehensive foot exam, which, by the way, your doctor should do at least once a year. If you have neuropathy and if you have diabetes, your shoes should probably be taken off at every doctor appointment. So we have a sign in the waiting room that says, take off your shoes. But the comprehensive test has 4 components. The doctor looks at your feet, assesses for any abnormalities like a bunion that might rub on the shoe. They look for cracks in the skin or maybe a fungal infection. They look at the toenails. Then they palpate. So step 1 is looking. Step 2 is feeling. They're going to feel for the pulses in the feet. There's some pulses on the top of the feet and on the side of the feet, and they're going to see is the blood flow good. So that's step 2. Step 3 is the monofilament test, and they're going to take a little filament and they're going to touch about 6 places on the bottom of your feet to see if you can feel that. And then they're going to do a vibratory test or a position test. And that is where they either take the toe and they move it up or down while your eyes are closed and see if you can tell, am I up or am I down? Or in my clinic, I use a tuning fork. So I'll make that tuning fork clang and I'll put it on that first bone, metatarsal bone. And they should feel it for about 12 seconds, feel the vibration. So with their eyes closed, I ask them to tell me, when the vibration goes away. And so if any of those are abnormal, they have an abnormal exam. So we do the comprehensive foot exam. So I'd done this on this patient and he felt everything. Everything was great except his great toe on his right foot. He couldn't feel anything. And so South by South came. He was a vendor. He was on his feet for 12 hours. There was some rain. His foot got wet. He took off his shoe. He had an ulcer. 2 weeks later, the toe was cut off because he had poor circulation and he just didn't pay attention and the infection rapidly went into the bone. And that's why we say that as soon as you have an ulcer or something, you immediately get in, because what can we do? We can give antibiotics to, if an infection is in the skin superficially, it's pretty easy to treat. Once it gets into the bone, it becomes very, very difficult. So, so the most important thing is being aware of your risk and addressing any problems very quickly. The other thing I tell people is if you have diabetes and neuropathy, never get new shoes and wear them 8 hours the first day. Had another patient have a funeral to go to, and she bought some high heels, wore them 8 hours, developed an ulcer on her toe, and that led to an amputation. So the rule with diabetes is, even if they're orthotics and special diabetes shoes, you wear them 1 hour the first day in the house, check your feet carefully, no blisters, 2 hours the next day. After the third day, if there's no problems, they can wear those shoes all day. But don't buy new shoes and wear them to work for 12 hours, because if you have a problem, you're stuck.
Right. Okay.
And if they don't fit, take them back. Diabetic shoes can cost $500. Your insurance company may pay for them if you have Medicare, but do not keep a shoe that doesn't fit. I have a lot of patients that have these very expensive shoes in their closet. Not helpful there. And if you have a shoe that's caused a blister, get rid of it. Do not keep it. It's too tempting.
Yes. Thank you.